Hi everyone, I'm Dr. Ipshita and welcome back to my channel. So I read somewhere that Bill Gates said that if he had to choose between a lazy and a hardworking person to do a certain job, he'd prefer the lazy one. Why? Because lazy people tend to work effectively or find a more easier way to do a certain job. Well, bear this in mind when you watch this video because today we are going to talk to Dr. Nellore. He's an oral and maxillofacial surgeon who has worked as an associate professor at M&R Dental College. Not just that, he was doing his regular consultations as an oral surgeon, but because of a few decisions that he took while pursuing his post graduations and also after that, he has gone from being an average and a lazy student, which he calls himself, to now somebody who's pursuing his PhD from IIT Hyderabad and has received funds over 75 lakh rupees from the government of India. Not just that, he's a very successful entrepreneur, has two startups those are running right now, and he was offered a sum of rupees 10 crores for one of the products that he's developing. If that's not inspiring, I don't know what is. So do go ahead and watch this video if you're a dental student, an undergraduate or a postgraduate. More so if you're a postgraduate, because you will understand why paying attention to your thesis is important. If you really understand Dr. Nellore's story, you will figure out how while he was doing his thesis, he took a few important steps right there. He bore a few things in his mind which entirely changed the way that he's pursuing things right now, right? So make notes, make sure you're paying attention while you're watching this video, and I hope you take something away from it and implement it in your life and turn out to, and turn your life around. So, yeah, without wasting any more time, let's just get started with the video. Have fun. If you do like it, please do hit the like button, and yes, please subscribe to my channel. Do share it with other friends of yours who can benefit from this. And if you have any doubts, please have them posted in the comment section. If you wish to reach to Dr. Nellore, or if you have any questions for him, uh, I'll have my mailing ID linked down in the description box. You can reach me there and I'll forward those questions to him. And yeah, I think now we can get started with the video. Have fun.
Please do tell us a little bit about yourself.
Yeah, thanks for this introductory whatever the initiation, whatever you have started, kind of a startup also. Myself, I'm Dr. Vijay. I'm a consultant maxillofacial surgeon, and I was working as an associate professor in MNR Medical and Dental College, and I'm a director and co-founder for two startup companies. Scale Region Private Limited and Medic Invention Private Limited, and passionate researcher and innovator. That's a brief introduction about myself.
But that's so amazing. This is the first time I've ever come across a dentist who's also started, with two such great startups. That's fantastic, sir. So we'll get into what you're doing towards the later part of the video, but we'll just start your story from the beginning. So
Okay.
did you always want to become a doctor growing up?
Frankly speaking, I was just thinking, never in my mind that we have to become a doctor or an engineer. It was like, after fifth standard, I wanted to go become. I have to pass fifth standard and go to sixth standard. It was not even a thought process that we have to become a doctor or an engineer to make money, run family, to take care about parents. It was just I was living to the moment and enjoying the moment, and it was my dad's thought process that since we were the second generation of from an education background, he was thinking that one of his kids should be a doctor. And fortunately, both my elder brothers were engineers, so I was the only person left out to become a doctor. So I was not having any mindset. I just wanted to execute whatever my dad was having a vision. I thought of, chalo, let me take that as a challenge. And with that journey, I started working on it. Started working hard like any other people, prepared for entrance, writing an exam. Fortunately, couldn't crack MBBS, and that I could able to join dentistry, and what I'm enjoying right now. I regretted initially for initial few months, but now I feel I'm fortunate that I didn't do that, and I got some other field. And this is a really interesting myth. Actually, when we are doing medicine, also we have only one thought process that MBBS is the only field.
Yeah.
And we don't have any other diversion also. There is no veterinary, pharmacy, or dentistry. So I felt like, that has given an option that if you don't have MBBS, you have an alternative option also. So dentistry, that's how I entered, and now I'm enjoying what I am doing right now.
And I really like how you said fortunately, because that is not something you come across. I really like it how beautifully you put it. So that's fantastic. So 5 years in a dental school, how was your experience there?
It was a wonderful experience. I think foundation for any kid during the graduation is most important, and that's what I feel like. I was fortunate enough to get into a prestigious institute, that is Army College of Dental Science, where my foundation was so strong by our senior teachers and professors, that my post graduation became with ease, and I could able to do with very much ease, even though I could got second division in my post graduation, but I enjoyed with a strong foundation actually. It was a very wonderful experience actually.
Right. And did you immediately decide after your internship that you wanted to pursue a post-graduation, or did you take some time and, you worked in a clinic and eventually you came out to the decision that, okay, now I must do a post-graduation? Or was it an instant thought that, okay, I have to do it?
It was not an instant thought. Whenever we are doing our internship, it's like there are kind of people who are jolly and who are people who are academic padaku karke. When we are integrated with this kind of group of people, that time I was also like padna hai. That's kind of, I was not in a group where to enjoy and then simultaneous study. So seeing the people they are preparing for competition, let me also prepare. So I didn't have any motivation that I have to do a master study. But subsequently, when I started saying, yes, if we do master, it will be having an add-on beneficial for all of us. So that motivated me from internship that I have to prepare for master.
Right. And so what about masters in oral surgery? Because oral surgery, I feel, is one field which is meant for people who are very passionate about it. Because unless you have that spark inside you, you can't do oral surgery. That's my personal feeling. You tell me more about that.
For me, it was again exposure during internship. I was not good in prosthetic work. Neither I was good in conservative. I've always been in the last bench kind of stuff in prosthetic and conservative. No one was appreciating my work. Even my craft, oral path, the DADH, the carving was not been appreciated by anyone. But in surgery, somehow people were appreciating my work. They were even I was so much comfortable of what I was doing. So I found that my strength is in surgery. So it's like I always that became my strength, and I wanted to execute surgery. So only option which I kept was to do PG in surgery. So no other alternative option.
Oh, that's really good, and I really appreciate your honesty. You and the way with which you decided that, okay, this is the field that is meant for me, because that happens too. And a problem that I see with a lot of people is, or a student is, because they're under so much peer pressure. Okay, maybe this looks like a happening field, or that does. Like oral surgery has a big name, so a lot of people want to join it just because oral surgery is what is the word for it? Adventurous,
Fascinated
or fascinated about being an oral surgeon has a charm in itself, isn't it? But I think we should pick up subjects that you connect to. I think that's very important, isn't it?
Very important.
Yeah. And so, sir, then you left for your post-graduation. You did it from MNR. How was your experience there for 3 years?
Actually, it was also accidental. I was coming from an army institute. I was not aware of there is some private institute or any other government institute in Telangana and Andhra. I was not aware of it. I just wrote an exam and with an intention that we have to go and do surgery in a government institute only. But unfortunately, I could not get in open category. So then I decided, my father forced me, don't waste your time, go and get it done in some private institute also. So I was not aware which institute to be taken. And there will be category of, like now we are thinking like, doing from Savita, Darward is like, it's fortunate for people to get it done from that institute. For me, like any private institute, like the same I felt. Only thing why I choose MNR was for my, though I was below 100 only, top ranker, but still I choose MNR was only reason was our, you might be knowing Srinivas Gadipalli sir, he left the institute Army College and he was a professor and head of the department in MNR. So I felt like I have connected to sir and I have very good experience in surgery and I was wanted to become a surgeon and I have a person who is already in that institute. So I just went into the counseling center and then asked for MNR Dental College and I want to do oral surgery, that's it. And I got very easily and I entered into MNR Dental College and later part, it was like a very, very wonderful experience. Touchwood, I feel like I have been fortunate to get trained under Srinivas Gadipalli sir. Whatever I am today is all because of his foundations. So very fortunate about it.
Yeah. And just to give the viewers a brief context, so Srinivas Gadipalli sir was basically somebody, he was our teacher, and he was our teacher when we were doing our undergraduation. And he was a fantastic oral surgeon, really. You could not miss his viva, could not escape anything. He was a very strict teacher, but a very jovial one at that. You know, he made the subject very, very fun, to, so to speak,
Yes.
isn't it? And I really, again, appreciate how you said that, you know, because a lot of us students have that mindset that, okay, undergraduation के बाद PG तो government college से ही करना है कैसे भी करके, and thereafter you waste so much of time. If you crack it, nothing like it, that's great, you know, works well. But if you don't, again, you don't have to get demotivated or demoralized. There are plenty many good colleges who have great teachers. And again, a great point is look at the connection that you formed with a teacher and how it changed your life, isn't it?
Yeah.
You are doing so well, so wonderfully. We'll just touch upon that shortly. And it's all because of how you took that decision that, okay, my teacher was here and I have full faith in him. If he's somewhere, that place must be good. So let me just go and see how it was. Fantastic, sir. And so 3 years of post-graduation, what were your thoughts after that? So what, like, usually since you had come out of a clinical field, so oral surgery, there are plenty many things to do. You can open your own clinic, you can start consultation, you can also get into academics. That's the conventional career path. So what did you have in mind after that?
There was two things which were clear because we are coming from a very middle class family. The kind of pressure है ना, पढ़ लिया काफी है, चलो कमाना शुरू करो. But I was so much interested. The environment also supported me so much that है ना, before my post graduation was completed, somehow I got a very good connection from IIT. The IIT people penetrated. They got they wanted to have some collaboration. Somehow these institute people felt that this person can be a face of the organization, who can equally can represent this organization to IIT. And that's how though it was my intention to do fellowship in oncology and fellowship in orthognatic surgery, but I felt like it was just a plan, but somewhere in my heart it was like I want to do something research, innovation and startup and develop my own company. That was there somewhere hidden in my heart. And I feel like when you have a thought process, and environment do connect to us. So it was the thought process, but somehow it got connected to PhD. That's what I can convey.
No, that is true. I believe in that saying, you know, what I seek is seeking me. So even though you may not know, but if you're truly looking out for something, it will find its way to you, isn't it?
Yes.
Yeah. So now you have 5.5 years of research, and you just told us briefly about how you connected with IIT. So how was it like you had joined MNR and you had started teaching over there also after your postgraduate?
Yeah. That is really a wonderful, that's a really a funny story actually. And these people came, and that person, I want to name his name, Dr. Vishwanath sir from mechanical department, Vishwanath. He came, he wanted to do some collaborative project. And being a surgeon, we were forced to do some peripheral posting, and we were being trained about emergency get trained equipped with emergency parameters. So we will do peripheral posting. So I was being asked to do some CPR protocols. We have to learn, certify ourselves to be a CPR trained persons actually. While during that process, I learned that there are certain limitations in myself. I was not doing effective chest compression on the mannequin actually. So I felt like it's my mistake, because of which the patient life is on stake. So so I thought of is me, like me, many people are there who don't have well built. They may be well built, they may not be well built, but the kind of effectiveness to perform the chest compression was lacking actually. So I felt like there is certain things which is lacking, and because of us the patient life is on stake. Let me work on it. And somehow this mechanical engineer person wanted to collaborate. As I said, the energy and environment all contribute towards your thought process. So when I convinced about my proposal about I want to have developed this kind of product, they were so happy, and they have invited me into the institute. And this institute said that instead of the innovative thought process what you're carrying, why don't you do a PhD? So they only guided me to take forward for a course, and then they guided me to biomedical engineer. So it was like a red carpet welcome for me. And funniest part was, I have not yet completed my post-graduation final paper 3 I was writing, and before day I was giving interview like 11 o'clock in IIT Hyderabad. My time was, my time slot was given 4:30, but somehow the interview was extended to evening 11:30 actually, and I was the last person. And if I fail in my post-graduation, then there is no point being selected. Though I was selected, but I have to crack the post-graduation. So it was a tricky thing, but I enjoyed my post-graduation, both professional and personal life, which I missed during my graduation. I was not enjoying. I was just पढ़ाकू का इनका बंदा था, पढ़ते रहते थे, वो ही है, but I was not enjoying. So I have established those facts of enjoyment both professionally and personally in my post-graduation. So it has helped me a lot and in developing a network and exploring my knowledge, exploring my mindset. And somehow I cracked and PGB khatam ho gaya. I've been given a red carpet welcome as an assistant professor in the same institute and in IIT Hyderabad. So I think very few people get that kind of opportunity. And who will say no if you get something in IIT and people are calling and go and get it done actually. So that's a wonderful experience. And what I feel like, I am very lazy person. I am a lazy person with personal life, not professionally. Personally, I feel like, and a lazy person have always and have an intention that he will find out a way to make his work easier. So like even the chest compression, I was not able to comfortable in performing chest compression. So I thought my mistake, and if I don't do, it's my mistake, and because of a patient life is mistake. Let me develop some device which can perform and overcome my errors. So that's how the innovation starts. So it's a wonderful journey. And again, I said that I don't take pressure. Even PhD is not an easy task. When you are doing in such a reputed institute, it is not an easy task. They will make you work like anything. And again, I will work the way I want to work. Again, I am a very tough task student for my guide, for my institute, either way. So it was a difficult task for them. And somehow, whatever the way I wanted to execute, I have executed in my own way actually. Like they wanted me to do cell culture, which I'm not interested. A surgeon doesn't go again and want to sit in the lab and want to do some cell culture. I was not interested.
Yeah.
So I was reluctant. And my guide was, yeah, kya kar raha hai yaar? You have to do complete the task. So he always used to have a negative impression about me. But the kind of innovation I used to talk, I wanted to do, they have motivated me so to greater extent that I have created furthermore paths. Like I wanted to generate a revenue.
Yeah.
So what they have guided me that there is something called as a Prime Minister Research Fellowship scheme, which is very most and India's most prestigious scholarship actually. And this is, I want everyone should work on it. And government has beautiful scheme where they will directly fund you 90,000 as a stipend, which is the highest paid stipend you will be getting actually. So once you are financially independent, you want to do the things as per your requirement. So I was fortunate to receive that in 2017, all among the top 19 candidates all over India. So that was one great achievement I had. And these things has again integrated me that, chalo funds to aa raha hai, but I am so lazy again that to go again to do the work in the lab. I was not interested. I'm more interested if somebody call for an impaction or a fracture or somewhere, I will go there, but I was not interested in doing that. So again, my guide was so frustrated about me that he is not listening kind of. So then I thought, how should I execute the task? Why I'm telling the entire story is it is just that if you are passionate, you don't need to take any kind of pressure from the external environment. You execute the way you want to do. Definitely things will fall as per your requirement, and if you're doing ethically and correctly, things will happen. And that's how the startup, my mindset of to start as a startup career and entrepreneur was started from that point of view. I thought of yeah, I am not good in this thing, I'm not good in this thing, but if I have money, I can imbibe the person who can execute this thing. Or I can have a person who can work for me. I don't have money, but there is something called startup where government can fund us. We can get a lot of money into the system, and whatever there is in my mindset, I can execute through them, and they're expert in doing that. I'm not an expert in that. So I thought of let's create this kind of entrepreneurship. My guide was always supportive. Dr. Nellore, he is a medical background person, MBBS, and he did his PhD from IIT Kharagpur. Very innovative person actually. And he always says that he never believes in whether I'm working or not. He believes in my result. That's what I have till today. We became a research collaborator now, and he always believed as long as you work and deliver the result, I don't have any compliances on it. So very positive mindset. So he understood that till now I have not written my defense proposal. My thesis in my post-graduation also wrote by my colleague Dr. Srilata. So if you are passionate, whatever it is, even if you fail also don't mind. Do whatever you want, but if you're passionate, things will fall as per your requirement, but it may be delayed, but never be delayed. That's what I can tell you.
So while
that's how we are.
Nellore sir is telling us about his passion, you all must understand that he's somebody who who's received about 75 lakhs worth of fund from the government.
Yeah.
So that is huge in itself, isn't it? At such a young age, and you've already done so much. You have 4 patents in your name, and you
Yes.
are running 2 startups. So this by itself is very heavy.
Yes.
And it's wonderful that you're saying that you don't take any pressure. But then, sir, how are you managing it? Like 2 startups must be really difficult.
Two startup and this is 75 lakhs for one of my company, and two more product I got 35 lakhs from government of India, 10 lakhs from other government of India. So it's the one which I wanted to tell you about. Suppose my first product, which was the initiation product, was automated CPR. I wanted to develop a mechanical chest compression device which can perform automatically the chest compression
Right.
for 45 minutes, because 80% of heart attack occur outside the hospital.
Yeah.
And by the time patient from the hospital, from the point of attack reaches the hospital, it will take 40-45 minutes or half an hour time frame. And throughout the journey, either the patient or patient attender or the surrounding people are not well aware of how to do chest compression effectively. There's a lot of that is most important point. Even in the in-hospital setup also, the person cannot perform more than 2 minutes effective chest compression. The person has to change, other person has to come, they have to perform. So I feel like there is some errors which are happening, and because of this, the patient's life is in stake. So I thought of developing this device can overcome the limitation, and also can be useful for the patient in futuristic purpose, even for the doctor per se. Like it's a kind of a substitute for a ventilator or substitute for a defibrillator, where the people can keep it, both paramedics and medics, and they can perform. It's very absolutely an amazing device what we could be able to develop, and I must thank NMDC, a part of our organization. They have 1.5% stake of our organization, and they have given 25 lakhs to carry out this project, and 10 lakhs I received from Nidhi Prayas to develop the prototype. Right now, we are in a minimum viable product. That means a product which is ready for a clinical validation, and we are going for a validation of a product. Probably in 3 to 4 months, we are pitching a lot that we will be launching the product in the market actually.
Okay.
So and touch wood that when we started reaching to the hospital about this product, majority of the people doesn't know about that something this kind of devices do exist.
Yeah.
Not even single person has shown resistant about our product. Everyone say, yeah, sir, ye to need hai, sir. Yeah, I think Vijay, there is a need. There are certain people who said, do you have product? We will buy, purchase. So these kind of motivations are actually motivating that what we are developing is in correct direction actually, and it is a need of an art.
Yeah.
So this is one product which I worked, and then my thesis was on. I was doing my peripheral posting in Indo-American Cancer Center, where I was. We were 2 months training program. Which every post-graduation in oral surgery will be going through it. I was seeing that people are not having a correct integrated team who can work post surgery for the rehabilitation of the patient. If there is a cancer of the mouth, which is a major burden of Indian scenario, we are doing resection or radiation or chemotherapy. Resection is one part, but unfortunate part about the outcome of the after resection. Patient has disfigurement. Patient have paid very well, means they have a very good architecture with a microvascular flap, fibula flap. They will go for reconstruction. But the disadvantage is, are we thinking of the what the patient is thinking? It's what the doctor is executing. Doctor mindset is, I have cancer and let's execute and resect this part. Let the patients have some survivability. But what about the quality of life? Are we actually working on the quality of life, which is actually missing in the most of the parameters? Then that has ignited me. Can't we develop something 3D printed artificial bone soft and taking the fibula bone, and then we can just directly implant to the site, and then start the patient, even the surgeons, it will become easy, and outcome for the patient will be much more improvised. The patient doesn't want to go for another surgery. Per se, patient had gone for a fibula flap after cancer resection, and after 2 years or 1 year, the cancer reoccur. He will be so debilitating that I went to surgery, they did so much of extensive surgery, again cancer has reoccurred. But if we have something on a plastic material which has a tendency to convert into natural bone, then the chances he will not feel that much bad about it. And every possibility is that during radiation chemotherapy, even the product gets rejected, he doesn't need to worry that it is a it's our own body part, it's a foreign body, so we can do re-surgery also. So with that intention, we worked on a 3D printed customized bone graft. We got 50 lakhs from Government of India, then 10 lakhs from SDFC or CSR funding, 5 lakhs as an external funding. And then with this funding, we could able to develop the product, prototype, execute the product in a pilot study in animal model. We got excellent result in rabbit model. And we were being offered just to motivate the people who want to venture into startup entrepreneurship, that we got from a software engineer. I will not name the organization, but yeah, from one of the startup renowned software company, we got 10 crores as a initial what is called as venture capitalist wanted to invest in our company. So it may be a very small amount for people who are listening in startup entrepreneurship, but for people like us who have never think and started working on it, 10 crore is a very big amount.
Yes.
And it is so for me, we were so overheaded that no, our company, our product is something more than that. So we have not taken the call actually. But I want to tell you that if you are working with passion and if you're working with really the product is going to make noise in the system, there are people who are ready to invest, there are people who are ready to come on board, and it's going to be a big game changer. And it's a very good path, one of the good paths. So these are the two products which I work. There is one more product which I was working was to develop an indigenous dental implant. So I was, that again, it's all about the problem, what you see and how you want to overcome the limitation. So I thought of there is something called as distraction osteogenesis, which most of us have read during our graduation, that it has a capacity to increase the length of the bone. And it is a proven concept. So I wanted to develop any dental implant which will have inbuilt capacity for distraction of the bone, so that with a limited bone, we can increase the length of the bone height, and also that bone height will increase the size of the implant. And on top of that, we can place directly cap. So we don't need to do multiple surgery to remove the distractor, place a dental implant, place a cap. So I have integrated 3 different components in the same device to make the surgeon's work also simplified actually. For that, I got 10 lakhs. We got 10 lakhs to develop the prototype. And one which was very close to my heart was this presently which I'm working is anti-cancer drug. Probably you might be listening actually. You might have seen my work pertaining to that. This was an accidental finding, and what I found was this drug which I'm making, I'm applying for a patent, so I cannot disclose it.
Absolutely, please.
Yeah, so this product, what has completely cured the cancers in certain cases actually, which I have worked actually in very advanced cases actually. So then it's been used in some way in our day-to-day practice, and so I was so confident, why can't we try? And I was believe strongly in my hypothesis, strongly believe in myself. So I had this 87-year-old male patient who came and he was not ready for any surgery, chemo, radiation. I said, let's try and execute that. Took a volunteer consent and did it. It was like a miraculous reduction in the cancer, and that was appreciated. Then people said, you cannot directly use Vijay, that is not good. So I've been told to go for, against the proper study of in vitro, in vivo analysis, and then coming into phase 1 clinical trial. We did a in vitro analysis. Within 3 days, 90% cancer reduction of human cancer reduction in the lab has happened. And that was one of the wonderful results what we received. And I'm sure that it will 100% cure, because I can see it and can sense it. And in the rat mice model, we could able to induce a similar cancer in the skin actually, and we got 100% recovery rate.
Wow.
And in the rest of the 6 which got the cancer, which we didn't treat it, they had metastasis, reduction in the weight, and they were not dying actually. But my 3 mice in which we have induced the cancer, they got completely cured, they were gaining weight actually.
Wow.
And strongly believe that it can work to any type of cancer. Like it can work to breast, it can work to, except for blood cancer, which I don't want to claim, but it can work to majority of the type of cancer. So that was the most proud moment for me, which I felt like something if we can develop which can limit the what is called as surgical burden for the patient. Absolutely. And even for the doctor also. Doctor doesn't feel good that he want to do research and then he want to give that complicated lifestyle to the patient. Even if he can give over a counter some kind of drug which can help it, like it's like a healing ulcer, what we do, Dolo gel or mucopain gel. It's similar to like that. I want to develop a product we could able to develop to a greater extent. Now I'm searching for a bigger funding. And touch wood that I'm in touch with. I want to thank Rakshita ma'am also. She has connected me to some people who are in the ministry level, so they are helping me out to some extent. So if that's what I want to say again, if you have a thought process, if you keep working on it, there will be people who will come to you for some kind of help and to make your next step very easy actually. So I don't say the steps are very easy, but you have to be consistent and persistent about your work and passion. There will be environment will be, and the positive energy will be infused. Even negative energy will be infused, but you have to only take negative energy into positive criticism and keep working on it. It will be, again, I want to say, it will be delayed, but will never be denied.
Yeah. So beautifully you put it there, sir. Fantastic. I mean, it'll take me 2 minutes to take up the whole thing, but really, I mean, I'm at a loss of words. You're doing so well, and it's so good to see a senior do so well. You know, I'm sure you'll inspire so many students. I myself feel so motivated. So, though this was not a part of what I usually do, but do you meditate, or do you do something of that sort that puts your head so clear to what it is that so you're so focused in that manner? Do you use something like that?
Um, yeah, I whenever I feel isolated, no, I feel like my mind will work like anything. So only time when I get isolation was driving. When and I keep my phone silent, and doing, I have divided my professional and personal life so peculiarly that it's not easy task. But yeah, afternoon 2 to 4 I generally keep my phone silent. I sleep, and then 7:38 I try to close my entire working schedule and try to go back to my other work, like as a regular meeting with my colleagues, co-founders about the project, how it is going on. So we have to divide and rule, and make sure that your thought process is very much clear. So I don't do meditation, but whenever I'm sitting idle, no, I will get so many ideas. That's what I feel like. I'm a good innovator. That's what I can tell you. But like people like me, there are many people as in this world, but they have to utilize, they're waiting for a platform. What I want to say is simple. There are hundreds of people, they're not getting the platform, they're not getting the connectivity, how to reach to the platform. There are multiple hurdles and steps are there, but I can become a mentor for many of the people. But then I have been guiding few of the people, they have what is called as jumping mindset. Actually, they are not clear about, for them, even for selling out of our energy is also become sometimes we like, why we wasted so much of time. So there is some clarity they have when they are venturing into this, and that require a lot of commitment. I feel proud that you have taken such a good initiative of integrating different people who have from one background have gone to different background and doing multiple tasks, and they have done, and no one has done. That's why you have taken them, those particular like Suresh, health administration, embryology, Shiva. So for them, that path was very difficult. No one was there to guide them. Actually, similarly for PhD, there was no person who can guide us actually. So now the almost to a stage where I can guide multiple peoples in a correct direction. So though they can minimize the error, they can get an easy path. But again, there is no short methodology that you will definitely get it. But you will get some guide and mentor definitely for sure. So you have to be.
That's my idea, sir. That's also something that I want to do, because now otherwise I feel like, because there's no information at all, you think that
Yes.
there's nothing else you can do. Now look at yourself.
Yes.
You also had a very conventional career path, but now you thought of it. So now you are into entrepreneurship. You're starting 2 startups, and you have patents coming your way, you have funding coming your way. So it must not be easy. I'm sure it must be very, very difficult. But then you did what was required to be done. So even if I can give and what I basically want to do through this is, I just want to tell students that nothing is impossible. When you're in dentistry is a fantastic field, and there's so much that can be done in it. But it is going to be hard. It is not going to be easy. It is never easy. Any journey is never easy. So that's what I'm trying to cover here. When people talk about their stories, you get motivated in a different way. So I'm sure so many people, when they listen to you, how you, and again, I feel like figuring out, especially nowadays, is very overrated. People think everything should be figured out right from the get-go. That does not happen. Eventually, sometimes your plan will roll out, how it did for you. How your dad told you maybe you should do this, and then how after VDS you decided maybe you should go and do oral surgery because your teacher is there. And then, of course, how you decided the CPR is not happening effectively, and so maybe I should do this. And look where it has landed you. You are at a fantastic place, and I wish you all the very best. And we need more people like you. who can
Definitely.
speak so well and who can, literally motivate students. Because I've had a lot
Definitely.
of dental students who come and tell me, ki, ma'am, we are running down on motivation, we don't know. But
Yes.
here's a story for them. You're a live example for that, And sir is 1 year senior to me. So he is very young. That's what I have to say. And having done so much at such a young age, I mean, that's fantastic, sir, really.
Very good.
So
And
proud.
it's not an easy cakewalk. Yeah. Let me tell you, I have gone to 100 venture capitalists or more than everywhere I got a rejection.
Okay.
Everywhere I got a rejection because a venture capitalist is a private funding which is they're pumping on a startup. And there is a learning curve there also. Why they are rejecting? What is the checklist they are asking us? We have to keep working on the checklist. But now what we are doing, we are not reaching to venture capitalists. Now we are preparing ourselves for a venture capitalist, and when we will showcase, definitely sure shot like somebody more than 10 crores should definitely pump into the system. That kind of is a learning. So failure will come in your path. It's not that there won't be any failure. Failure will be there, but persistence is needed. That's what I think.
Failure is also important because unless and until you don't, how do you know?
Yeah.
And I feel like, when you fail at something or when something that you wanted does not happen, something better comes your way. I've seen
Yes,
that with
yes.
my life also, but here we are talking about you. This is what happens, when something that you really wanted doesn't happen, there's something bigger and better waiting for you. And it will come to you at just the time when I feel like it was required. And a certain learning experience. I'm so happy that you mentioned that learning curve is very important because
Yes.
otherwise, you first need to deserve and then you need to desire, isn't it?
Yeah.
So you have to first work towards it, become that person so that you are उस लायक बन जाओ कि वो आपके पास आए. So
Yes.
it's wonderful, sir. I am so happy this has gone in the direction that I wanted it to go. You must have inspired so many people by now. And any message that you want to give out to somebody who's listening to you, a young dentist who feels like because 2 years have gone down in COVID, people have not seen practically things happening, so everybody is running a little low on motivation. Any parting words that you would like to give out to all the students, being a teacher yourself?
You are the boss for yourself. That's what I can tell you. And invest on yourself, invest on your passion, upgrade yourself, upgrade with technology, and always keep when the more and more you invest on your passion, even if you fail sometime, you will definitely reach to a point of satisfaction, both professionally and personally. And that is what I want to say. You don't need to worry about, just keep investing, but only on your passion. Don't take any peer pressure, but keep working on your passion. You will definitely reach your destination.
Thank you so much, sir. This was perfect, and wishing you all the very success and many more fundings and maybe worth 50 or 100 crores ahead. And
Definitely.
I'm sure you'll make us all very, very proud. And I'll take your
And
interview again then.
yeah, and I'm giving an open platform. Anyone wants to invest on my proposal, definitely yes, because I'm always मिल के चलना है और सबके साथ आगे बढ़ना है. This is what the concept I believe. So anyone who is interested, they can definitely reach out to me. Pertaining to PhD, definitely it's not an easy task for a clinician. Getting into an external PhD, they have to prepare that, they have to sacrifice their professional life a lot. If they're doing in a very good institute, if they're doing in you will get a lot of institute. But if you are doing PhD in a very good institute, you should sacrifice your clinical career. If not, if you are in non-clinical career, I always suggest to go for PhD, because next generation will be mostly on a UGC scale will be asking for PhD also. So and it is a wonderful career. You will feel so interesting that they will ask you to do what you want to do. And I feel like when you are in post graduation of your for any field, take a topic which you want to work in a futuristic aspect. Because suppose you have any project, if your guide is good and you're able to convince any product which you are thinking about developing and can create a remarkable changes in the futuristic aspect, work on it. Because now there is startup, the government of India is pumping like 10 crores, 15 crores if your product is really viable, and you don't need to pay them. It's your own money they will be giving you to carry out the product, develop our company. And they only expect is that your product should become make in India, made in India, and globally also we should sell the product. You should create an employment, and it's a wonderful opportunity, and everyone should work on this. And a simple logical sense is, take your thesis during your post graduation, a product based material or anything which will become a future aspect. Because now the selection criteria is seeing what level of work you have done. The moment from dentistry, post-graduation you complete and you want to showcase which is there in your mind, they will not believe. Because so what I feel like, government is pumping money a lot. A lot means a lot. So even if I have some for 95 to 1 CR I could able to get from the government of India, you have to be very ethical. And now they are seeing a potential candidates. They have to find a potentiality among themselves, and then if they can execute the task to a greater extent and reach out to the system through a proper channel, definitely you will be given a lot of funds and support system, and then definitely that become a startup company and entrepreneurship, and you can definitely develop a company where you can hire a people and you can become a one more multimillionaire. Or the futuristic aspect, it's learning journey is long, but yeah, there is one more scope you can penetrate into it. This is simple task what for which people are being pumping a lot of money. So take up the during your post graduation, take up such kind of proposals, sir, where you can able to develop some kind of work or could have established some kind of work. And when you're reaching to the government of India, they will see what level of work you have done. The moment you showcase the level of work along with the kind of a background with which you came as a doctor degree, they give a lot of respect to doctors. So the kind of work and the degree what you're holding, they will definitely push and they will support you to get funding, and they will also guide and nurture you in a proper way to get the things in a proper channel also. So I feel like utilize the concept of the government funding, which many of the people are not aware, and definitely I can channelize them, I can give my inputs to them. But again, nothing is, you have to work hard and execute accordingly, and keep working hard, that's it, and keep investing on your passion, that's it.
So that's so important. Guiding in itself is so huge because right now we don't even know about that. But you're telling us, and hard work, so you will have to do on your own. So that is an individual commitment that you'll have to make if you want to succeed to that level. But of course, the fact that there are people to tell you that you may take this path, that itself is great. And you've laid down a path. I think just taking your story into consideration, people can get inspiration and drawn. A great point that you mentioned here was for PGs, I feel, because we don't give that much importance to what thesis it is actually that we are doing. And this is a fantastic point that you mentioned, that if somebody is doing something on some medicine or some device, you might as well do something very novel that you think you can work with later on, because the ground is set right now. So this is a very nice point. I think any postgraduate watching this should keep this in their mind, that if you're starting with your thesis, take up a topic that has a futuristic implementation that can be altered, modified, and used later on. Thank you.
There is one short example where this is actually this should come into the mindset of a medical person. But it came to a IIT Bombay medical student. They have developed a very good product. One of the salesperson came to us. He didn't develop any innovative product. What he has developed, I just want to give an example of some other also. Like they have developed one microscope, a portable microscope or a microscope which will have an iPad connected to it, and has the person doesn't, oral pathologist or a general pathologist doesn't need to go and fine tune the slides. He just need to keep a slide, and from here he can sit and watch through the iPad actually. So there is no actually smart. They have just integrated smartness to the existing microscope with the telepathy also, where they can record the video on table and they can share to the through mail. They can take a screenshot, send to the mail. They can take a printout and limited the noise which are there for a oral pathologist and general pathologist. Noise in the sense could be multiple: neck pain, watching multiple times, seeing the scenario, nuclear lie. It is a headache. But if is the how he is overcoming the noise, seeing here, analyzing it, the post-graduation may not understand it. He can sell through mail to a ma'am who has not come to the institute, and without delaying the report, the ma'am can see the live recording of the slide, and she can say that okay, these are the features I can say. She can immediately send with a e-signature also. So those these all the noises which have been, because to get the reports it is taking 1 week. Now within 2 to 3 days only the reporting can be done and can be dispatched, and with the documentation. And they are selling the product. This became a product. Now everyone is saying, yeah, it is overcoming the limitations of the existing microscope. Let me purchase. So that become a product based selling of into the market, and they're making very good money out of it. So it's, you don't need to start from a zero. You can just start from a scratch existing product. What are the limitations with the product? Start working on it. Develop a team and start working on it. You will definitely end up in developing a very good product. But before doing anything, make sure your product is being criticized both positively and negatively by multiple people. Criticism of your product in initial stage is most important. If you don't get criticism, because if you think that for us, our product is definitely novel. We feel अरे यार मैं तो टॉप हूँ, मेरा जो काम कर रहा हूँ वो बहुत बढ़िया है, उससे कोई बड़ा प्रोडक्ट नहीं है. ये this kind of mindset will actually later part we will be again going to grow. Let the product out, don't tell entire content, let the people criticize it to the core. Both take both positive criticism, both negative criticism, and develop your own solution out of it. The product will sell into the market.
Very
Like
nice.
I want to appreciate Jaivir also. I think your batchmate Jaivir from he has developed one suction tube with antimicrobial coating.
Okay.
The innovation is nothing. The coating has an antimicrobial property. The people will buy, at least majority of the clinic will buy thinking that he will convince the patient that it has some antimicrobial coating. I should purchase this product, and I can convey to the patient also. And I'm using all sterile product for you, and the product will sell. These kind of small things are very interesting, and they will sell like anything into the market, and you can make money satisfactorily.
Right. So it's all around you. You have to utilize your brain muscle if you put it in function. And so before we end this, so what are certain hobbies that you follow on an entirely different note? I'm sure you work a lot, but what is it that you do for relaxing, chilling? We want to cover that part as well.
I want to spend most of my time with my daughter only. I don't like going out, spending time with anyone. I feel like spending time with her will give a lot of pleasure to me. So I enjoy spending time with her. I enjoy fighting with her. So that is the only way I relax myself.
That's very nice. Thank you so much, sir. It was fantastic to have you on board. And there's so much for people to take away from this particular session that we had with you. Yeah, you wanted to say something?
Yeah, I want to thank a couple of people who have let me to come to this stage.
Please.
Yeah, I want to thank my parents, my brother, my uncle, and who was supported during my education career, and Dr. Srinivas Gadipalli sir, who has laid the foundation, sculpted me whatever I am today, and Dr. Vishwanath sir, who thought that I am a very good person to penetrate into IIT Hyderabad, and Dr. Sujata ma'am, principal of MNR Dental College, who found that he is the person who can represent the institute to IIT, and I think I have reciprocated in a similar fashion, and many more people who have positively or negatively criticized about myself, and whatever I am today is all because of them.
That's so nice, sir. Thank you so much for coming on board and for giving out time from your very busy schedule. And thanks once again. I hope we'll get in touch with you very soon.
Thanks.
Right, sir. Thank you so much. Take care.